Good evening, everyone. A very warm welcome to dear Foxians and to all the viewers who have joined today in the Gyan Pravah podcast series number 28. This project is entirely conceptualized by our beloved President Foxy, Dr. Sunita Tandulwadkar, Madam, and it is a very unique and innovative idea of spreading knowledge. I am Dr. Suman Sinha, Chairperson Vaginal Surgeries Committee Foxy, and your host for today's episode. And I will be hosting different personalities with different theme every month on 25th. So stay tuned. Today, I will introduce to you a very distinguished and well-known Foxy figure, a pioneer in vaginal surgeries, teacher of teachers, our respected Dr. Purna Chandra Mahapatra sir. And I will be taking you to his journey as a gynecologist. And now, for the welcome address, I take the honor and privilege to invite and introduce our very dynamic, visionary, creative, focused, and empathetic President, Dr. Sunita Tandulwadkar, Madam, who leads 45,000 plus Foxians from India and abroad and excel in all her expeditions. Madam, she is Chief of IVF and Endoscopic Center, Ruby Hall Center Clinic, Pune. She is founder and medical director of Solo Clinic IVF, a center for excellence in infertility. She is also co-founder and medical director of ELIV, which is a stem cell research and application center at Pune. She has an extraordinary achievement of bringing India's first stem cell baby, which is also internationally first at the age of 45.
Thank you, Suman. Thank you so much. Dear Foxians and friends, I welcome you all for this Dr. Suman Sinha's podcast with Dr. P.C. Mahapatra. Friends, 30 committee chairperson on 30 days. The dates were given to each everyone. So on 25th of every month, you will expect Suman to be with some of the national or international, academically very popular, or she may choose someone from a social or the cultural background. What is very important is with every podcast, she will give us a fantastic message. Friends, my all committee chairpersons are working very hard to create the best of the podcast of 45 minutes for all of us. I humbly request all of you, 8 p.m., join Gyan Pravah. You may be driving, you may be eating, just put a Bluetooth and hear my team, and you will enjoy. I'm very sure with every passing day, you will fall in love with Gyan Pravah and you will be spreading about it to your friends and all across the country and abroad. 46,000 gynecologists from India, making this Foxy organization very vibrant. And I'm sure you all love Foxy and you will be visiting Foxy website from time to time for any more updates. Today, we have the father figure of vaginal surgeon, Dr. P.C. Mahapatra. It will be immense pleasure for all of us to listen to this podcast because I know Dr. P.C. Mahapatra. He is not only no-nonsense surgeon, but he is no-nonsense in delivering also. So he will pass on the most important tips on a vaginal surgeries or on his experiences, which every tip, if you think again, if you hear again and again these podcasts, because they are available on Foxy social media platform, you will understand that every time when you hear, you have learned something different. So let's put ourselves into academics. Let's put ourselves into improvement in our day-to-day female, woman, health, everything. Thank you so much, PC sir. You are always there with every Foxian. Probably the only Foxy president I know who walks in and hundreds of Foxian run to touch your feet. I have not seen this with many, and that's because you remain one of them. Thank you so much for giving your time to my Foxy presidency in this Gyan Pravah. I'm sure people have overbooked you, and I'm trying to cut them because I want every podcast to be novel. Thank you, sir. I don't have words. Thank you. Love you.
Thank you,
Back
madam.
to you, Suman.
Thank you, madam, for your pearls of wisdom. And thank you for giving me this wonderful opportunity.
Thank you.
So now I take the opportunity, and really it's a pleasure to welcome and introduce our very respectable teacher of teachers, guide and mentor to many of us, one of the pioneers of vaginal surgeons of India and abroad, none other than Dr. Purna Chandra Mahapatra, sir. As we all know, sir is Professor Emeritus of SCB Medical College, Cuttack. He is the past president of Fogsi and Fogsi representative to Suffolk. There are so many jewels to his crowns. Recipient of Vidya Vibhushan Award by Fogsi and ICOG in 2021. He received Fogsi Lifetime Achievement Award in 2023 and also ISAR Achievement Award in 2023. He is founder of Prachi Institute of Mother and Child Care, and he is chairman of Prachi Education Foundation. He has also put forward his foot in politics and currently he is BJP Pradesh Adhyaksh of Orissa. We would like to see him as our health minister. I'm really impressed by his mission of life, and that is he is born to serve and he wants to live for others and he wants to work till his last breath. He is very passionate about teaching and he is grateful to be a man, not rather than be a great man. So welcome, sir, to this platform of podcast, which is a gift to us by Dr. Sunita Tandulwadkar, madam.
Thank you very much.
So, sir, we'll moving to the questions, which
thank you, Suman, and thank you, PC sir.
Thank you very
for
much.
Giving time of our future leaders of Foxy. Thank you.
Thank you very much. The leader, the unique leader of Foxy, Sunita, which I dreamt a few decades before, and Sunita, the vibrant chairperson of the Vaginal Committee of Foxy, and the concept. I think this is a unique concept by Sunita that is involving all the chairpersons and bringing everyone together. And this podcast is a new concept which is led by the leader Sunita Tandulwadkar for that. I really appreciate and I love to join with you and be associated with all academic activities throughout the year. It's impossible to attend because day and night you are doing all academic activities 24/7 under your able guidance for that. And you have become not only a president of Foxy, you have become an institution right from the beginning for that. And I hope it will continue till your last breath. Thank you very much, Sunita and Suman, for that, giving me this opportunity for that.
Thank you.
Thank you, sir.
So, sir, my first question goes to you. What motivated you to become a gynecologist?
Well, before that, thank you very much for this podcast where I think it may be beneficial for the viewers for that. But from my childhood, I was interested to be a doctor, that's all. But I didn't decide that, yes, then my father was not interested. My parents were interested to become a civil servant, but I had my biology and mathematics. So at that time, if at all I will not be a doctor, I will be an engineer. So I took admission in the engineering courses. After 3 months when I got the medical, then I immediately shifted and my decision was dealt with and it was materialized and I was happy to continue that. Well, during the course of medical curriculum, for 4.5 years studies of MBBS and then 1 year of housemanship, then I studied which subject is interesting and which subject I should do for post-graduation for my finalization of my whole career. Then I thought the subject of obstetrics and gynecology touched my heart. I thought all the profession, they do it by using their head or hand. This is the only subject where the head, hand and heart are combined with that. So that's why I was inclined to this profession for that. And that is the genesis of my entry into the medical curriculum and become a gynecologist.
Thank you, sir. Was there any hurdle in choosing this career?
Invariably, hurdle means at that time we have to appear some entrance. I was the second batch in the entrance examination. If I would not have got it, then I would have thought of different thing for that. But certainly a hurdle is there. You have to prepare, you have to do a hard work to succeed for that. And of course, the major thing is that about the God's desire and destiny for that. I am a strong believer of destiny. God has given me this, choosing this profession for that.
Sir, we wanted to know some of your experiences in labor room. May not be that good.
Well, labor room is such a place where I can see you. It is I could say that it's an addiction for gynecologists or obstetricians. When we deliver a case, suppose I delivered a case by instrumental delivery, forceps delivery, whole night I was just stitching, repairing the vaginal walls and all that. There is a PPH, and whole night I spent on that. And the next, when I finished this procedure, I told that I will promise never to enter to this labor room anymore. And after 2 days, it's a nostalgic, it's an addiction. You have to come to the labor room for that. And it's all applicable for all obstetricians and trainees in obstetric practice for that. There's some sort of attachment is there in labor room for that. And that is the seat of learning. I find that is the main seat of learning if you want to be really an obstetrician for that.
Thank you so much, sir. Now, from a simple boy in labor room, and now you have reached to the target of being president of Fogsi. So, can we know from your mouth your journey as President Fogsi?
Well, I was, this is an academic body. I know Fogsi I respect a lot. And I've seen in Fogsi when I was attending the conference, I was the last bencher, even standing and didn't get a time. And I was seeing the speakers, learned speakers speaking, that has motivated me. And that also I thought, I have dreamt, can I get God give chance to be in some years, I will be in that position for that. That has hinted me. That ambition was there with me. And Fogsi is a brilliant organization. I entered as a member. Then I entered as chairperson of the Medical Education Committee in 2002. Then 2004 I became a vice president. Then in 2011 I became a president of Fogsi.
Thank you so much, sir. Now, little bit of your life journey.
Personal life, you mean to say?
Yeah,
Yeah.
personal life.
Personal life, I love my profession most. And therefore, I'm married to a gynecologist. She is a gynecologist. My only daughter is a gynecologist. And my son-in-law is also a gynecologist. Whether it's a chance or choice, I don't know, but it has happened. And I'm happy about it.
Thank you so much, sir. I've heard you have helped many people from underprivileged background. So, was there any motivation for that?
See, it's a self-motivation. From the beginning, I belong to a teacher's family, and I've got 6 sisters. I have seen what is the hunger, what is the starvation. I have seen that in my life. I have not born in a silver spoon in my life, in my mouth, and that's why charity was from the beginning inbuilt in my mind for that. And till today, therefore, I see about 100-150 patients every day, and I don't charge a single pie. My whole consultation is free, and I operate about 15-20 cases a day. And of course, I don't take anything from doctors, I don't take anything from defense personnels, I don't take anything from teachers' family, and this is my satisfaction for which I am surviving with that. Still I am surviving.
Yes, sir. So, we are really blessed to have you, sir. So, can you give a message to our women that their health is also equally important as their family's health?
Yes, we have entered into this subject. Gynecology is a subject which gives healthcare starting from creation to cremation. From the birth till death, we are involved in that. And therefore, woman is the main nucleus in the family and the society for that. I believe that unless the woman grows, I think nothing. The society cannot grow, the family cannot grow, and the nation cannot grow. And we are fortunate that God has given me a chance to become a woman healthcare provider for that.
These days, our younger generation, they are not preferring to become a gynecologist. They want to go for some other career, maybe medicine, maybe skin, maybe any other. So,
See,
what can we suggest them?
It is an individual preference, I don't deny. I say, any subject you like, I advise them two things. Be a human being, number one. Whatever scientific excellence you gave it, if a good human being is there, it's a primary thing. And second important, you want to excel in that particular subject. Whatever small, big or whatever, every subject is small, every subject is big, every subject is small. So therefore, you dedicate to this profession means you must make commitment for that, and then God will help you. You will grow.
As we all see these days, our gynecologists of present generations are adopting to endoscopic surgeries, and the art of vaginal surgery is losing its charm. So, you being a pioneer of vaginal surgeons, what are your suggestions to this young gynecologist to again revisit the art of vaginal surgery? How can we improve this surgery for our next generation?
Sunita, basically I am a teacher for the last 45 to 47 years. So it's not that only adopting a particular subspecialty is my ambition. I am a jack of all trades and master of none. That's important. But there are something which I love, and minimal invasive surgery. When the concept of MIS came in way back in 1990s, at that time when operative laparoscopy and hysteroscopy was just beginning in country like India and propagating, I think it has an impact. And I was also very much interested in endoscopic surgery for that. Not that I love vaginal surgery, but endoscopy is also surgery. I like it because it's a part of the minimal invasive surgery. But vaginal surgery is something different in comparison to the laparoscopic. It has some signs, there is no dogma. There are some indications of endoscopic surgery. There are some indications of vaginal surgery for that. But I hope that this vaginal surgery, particularly mainly dedicated for hysterectomy, over past few years, I have seen the youngsters mainly concerned with the TLH. I think as if TLH has become a pinnacle of endoscopic surgery. There are many things you can do with laparoscopic surgery, fertility promoting surgery, lysis, ectopic, cyst, ovarian cyst. There are a lot of indications for laparoscopic surgery. And similarly, hysteroscopic surgery has a profound influence both in infertility, recurrent abortions, and various gynecological disorders for that also. But I think vaginal surgery, when it comes, and when question of vaginal surgery comes, it has an expanded horizon starting from hysterectomy to the various other forms of vaginal surgery like urogynecology, prolapse, and the descent of the pelvic floor. All these can cover with the vaginal surgery for that. If you compare, I always say that vaginal surgery and laparoscopic surgery, the debate is not there between these two. The debate is about hysterectomy, how we can reduce the abdominal hysterectomy and adopt a procedure of minimal invasive surgery. If you compare a hysterectomy, laparoscopic hysterectomy versus vaginal hysterectomy, I am doing a lot of endoscopic surgery also. I do a laparoscopic hysterectomy. I do a lot of vaginal surgery for them. But my indications are very, very clear cut. The cases where vaginal surgery can be done, I think laparoscopy I won't do. And the cases where laparoscopy is essential also, I will never do completely a dogma for vaginal surgery for that. And basically, as far as the minimal invasive surgery is concerned, for hysterectomy purpose, I always say laparotomy and abdominal hysterectomy is a large hole surgery. And when we come to the laparoscopic, it is a keyhole surgery. And when we come to the vaginal, it is a no-hole surgery. I think from keyhole to no-hole we have shifted, and seeing the morbidity, seeing the recovery of the patients posteriorly, I appreciate that the surgeons can be confident of doing more and more of vaginal surgery and vaginal hysterectomy for that. And that has given me some motivation and led me to be priority is a vaginal surgery for that. And if vaginal hysterectomy is not feasible, I think you can go for other methods for that. And it has been told by the pioneer of endoscopic surgeon who devised a total laparoscopic hysterectomy for that. So vaginal surgery or vaginal hysterectomy is a signature of the gynecologist for that. No general surgeon can do it, and you can do much better for that. And therefore, I love vaginal surgery for that.
Sir, it means that our present generation should start with vaginal surgery first, and then they should start holding the scope in their hand.
It's not that. It's not that sequentially you do one and one. As a teaching modality, I think technology has helped us. I will advise all the gynecologists to find out what are the indications for that. Don't be blind on vaginal. Don't be blind on endoscopic procedure also. Whatever the need of the patient is more important than the mood of the gynecologist. I believe in that. And therefore, there is no dogma in science for that. There are clear indications where you do it. But see, there is an abuse of laparoscopic surgery. A case where the kid can be delivered, say hysterectomy can be delivered up to 10, 12 weeks size uterus, there is no adhesions, nothing under that. And unnecessarily for some other purpose, there is no indication of putting a scope into it. And you should do a vaginal surgery for that. A vaginal hysterectomy is indicated for that. But in other cases, say for endometriosis, known endometriosis, some adhesions and all that are there, where you assess it, that vaginal is difficult, you can put a scope. Vaginal hysterectomy, laparoscopy will assist it. And where you have got a laparoscopy, it will make more difficult vaginal hysterectomy very easier for that also. And that should be the motive for that.
So you go, suppose the size of the uterus is very large and you are not finding it feasible. So you can start with vaginal surgery, and if you need any help, you can put a scope as well and get it done.
I think for that, the pre-operative assessment is important, how you reduce the conversion rate for that. So pre-operative assessment starts from the sonography to the examination under anesthesia, and then they can decide. Size is not the only criteria for that. The mobility, the lateral vaginal space, the disease per se, the pathology of the disease, that is also very important in decision making whether you can go for vaginal or lateral. And if at all there is a conversion, I think there should not be an ego for that also. You can put it the scope and find out at that particular level for that also.
Yes. So there should not be any ego that you will not convert your vaginal surgery. It is a clear-cut message to our viewers. So you should learn both. The art is equally important, the endoscopic art and as well as the vaginal surgery art.
Yes.
So, sir, a little different from these vaginal surgeries. Now we all know that you have stepped into politics, and now you are the BJP Adhyaksh from Odisha. So, sir, what led you to this politics? What motivated you?
So I think it has become a chance rather than a choice for that also. My Foxians, I remember the past president of Fogsi, Behram Ankalesari, and many of the presidents also, what they find, they always tell me, I don't know why they tell me about that. And they told me that, why don't you join politics for that, for the better extended service for that? I told, yes, if there is a chance, my ideology fitted into that particular party, I will join. There is not a problem for that also. And now, when they took me and selected me in the Bharatiya Janata Party, the ideology matched, and that's why I joined. And I joined for the benefit of the public at a large for that. I cannot leave my profession. I told them, I am a die-hard professional. I cannot do anything at the cost of my profession, and politics also I do it for extended service of my society, of my people, of my country for that also.
How do you balance between your both the life, political life as well as a life of it?
It is. I'd say it's a difficult thing for that. But till date, I'm balancing those. I'm able to carry out both the things for that. But I cannot have one track for that. Maybe that you are in a position and all that. You cannot do it. At that time, I might think otherwise. But profession, I think I love my profession. I will continue to do that.
Sir, I have in back of my mind is if a doctor comes into politics, then situations of we doctors will improve I mean, the bridge between the patient and the doctor's relationship will improve. And these days, there's so much threat of medical legal cases and all. I think it will be balanced. And doctor will work without fear. They will look after their patients. So is it so? If
from the beginning, I tell that earlier what people was thinking politics. People thought that politics, I think it's not a job of an intellectuals for that. I feel different for that. So it is the time that earlier I wrote in some of the quotes, politics is the first act of, I think, last act of scoundrels. No, it's not that. Now the things have changed. I think it should be the first act of intellectuals. If you are the only armchair intellectuals and criticize the politicians, I think that's not good. You must be a part of that and feeling for that. And therefore, if you want to develop and the society and the country, I think education is to come forward more in number for that also. And therefore, it's absolutely essential for the building of the nation. You have some responsibility for the society. As a doctor, you have more responsibility for society and the country. And I think that good persons should enter into the political arena for that. Second important aspect, I've observed that if I suppose I have for last 47 years, I am in a medical profession for that. I know some of the schemes, some of the things, particularly catering the women's health. I think I have a vast experience on women's health and what are the problems of the women's health. I personally realize that, and therefore I can project it. I can be a part of the policy making system for that. At least I can be an advocate. I can be an advisor for the policymakers for that. And they will certainly listen to me as I am in the party itself for that. And that will also be very beneficial, not only for the society, but the political party also for that. They will get more information and better, I think, improvement in the women's health care for that. Because now politicians are more targeting for the women. Gone are the days where they're not targeting. Last 25 years, I was advising the politicians, the government, maybe non-BJP government for that. In my state, there is a non-BJP government. For the last 25 years, they asked me and I always advise, target the women. You are absolutely away from these schemes of the women, pregnancy, non-pregnant, adolescent, menopausal, everything. I think they are 50% of the population. They need some strength. They need some care for that, which I feel that they are deprived for that.
Even these days, I see all intellectuals they are joining politics. All the IAS officers, the doctors, so that they all are trying to improve the health of women. And if the health of women improves, the health of the society and the health of the nation will improve, and we will have a better place to live in.
Absolutely.
So again, sir, your message to all we gynecologists, Fogsi, or we are Fogsians, we need your words of blessings and to us.
Well, the message to the gynecologists, clinicians, I always say that profession. I again say that profession is your strength. Work is your strength. Service is your security. Maintain that for that. And believe me, don't run after money. Money should run after you. That should be the basic of that. You be limited to art and science of obstetrics and gynecology. Forget about the commerce part for that. Everything will be done with that. And a hard work is necessary, and a strong commitment and desire and a feeling for your beneficiary, for the patient. I think that will really do a lot of things for that. And after all, God will help. Divine power will help also. And that also simultaneously with the commitment will augment the standard of healthcare of the women in general. Second important aspect, as a teacher for the last so many decades, I find that medical education and youngsters, I think the skill development is important for that. They should acquire a good skill. I think acquire a skill and everything will follow you. That should be the first priority for a doctor for that. And the last is that I have seen 21st century is the best of times as far as the scientific development is concerned. 21st century is the worst of time as far as the human development is concerned. I think look on yourself that you should be a perfect, good human being for that also. A human nature, I think that is more important than extraordinary skill for that also. Both should be there for that. I will give a priority on the human values and subsequently the skill of the clinicians for that. That is my advice to the youngsters and the teachers and particularly the clinicians and who are like us, who are dedicated themselves for the health of women in general.
Thank you, sir. Sir, many of my colleagues ask me that you are so close to Dr. P.C. Mahapatra, sir. So can you help us, sir? Since you are having Prachi Education Center, and everyone wants to join that center to learn the principles of surgeries from you. So, sir, how can they join your education center?
Well, last 20 years, I have been involved in my center as a training center for that. Yes. And I keep a batch from Monday to Friday. I'm there, and Saturday, Sunday, I move across the country in different societies meeting for that. And for the last 20 years, I think I give training to the people, not more than 6 people at a time. And because that will hamper the hands-on thing for that. They'll be associated with me in the OPD, in consultation, as well as dental ultrasound, as well as the infertility work. My wife does it for that. And the surgery, whatever they are in the surgery, every day I used to do 15, 20 surgeries. So they will be part of that, both endoscopy, hysteroscopy, laparoscopy, vaginal hysterectomy, everything for that also. I do it. And that is going on. And I feel a pleasure of giving a teaching and a training for that. Apart from it, I have formed a Prachi Education Foundation for the last 2 years. And on that basis, my Prachi alumni, everybody joins. And every month there are more than one program being done in Orissa as well as outside the state also. And you can join also. I was just counting that a week before, 750 Prachi alumni all over the country are there. They are very much interested. They love me so much. And from them, I got the stimulus that they should come in. The genesis of this training came from the senior people for that. They say that, yes, the advances is going on. We want to be associated with you for a training. But we have a big hospitals. We cannot spend more time for that also. Every month the training for 15 days will be too much for that. And that's why they suggested that a short course training with a good amount of clinical materials can stop that. And that is the genesis for which I started this at a 5 days training. Apart from it, I do a conference, seminar, and some of the conclave on behalf of my Prachi Education Foundation. And I do a repeated program. Every year I do a program of mentors and mentee program. Just last week I did a program solving clinical dilemmas. 10 of my students, now they have become very senior. 10 of my students presenting their own dilemma cases, and we discussed it. I don't believe in this just discussion on the lectures, orations and all that, but these are some of the things which I love it for that, along with the surgical aspect for that.
Sir, how they will join your center? Is there any joining link or?
Yeah, you can, everybody is open for that. You can write me my email, or there are my assistants are there, my secretary is there. They will plan it and find out the dates for you. And I'll be happy to keep you in my guest house also. I have a separate guest house built for that also.
I think viewers, if you are, I know you are very eager to join Dr. P.C. Mahapatra's Education Foundation Center. So here is the answer to it. I hope I have satisfied your queries, and really thankful to our P.C. Mahapatra sir for giving his so valuable time for this podcast.
Thank you. Thank you very
Thank you,
much.
sir.
Thank you so much. I love you. I love Ranchi. I love you people. I can't remember how many times I've visited your society also. Not only your society, across the country. I love to visit all societies, and your love and affection has really motivated me to do more and more in academic field, in teaching field, in surgical field, and teaching is a passion for me. I will continue with that with your love and affection.
Thank you so much, sir. And we also to see you as our health minister. So it is
Oh, no.
and I think you go to that level.
Destiny for that also. The destiny which will say for that. Thank you very much.
That will come. We will pray for that.
Thank you. If God wants it, I am in the current. I flow in the current for that, and God wants it. Everything can be done. Whatever I am, because of something. I am not an extraordinary person. I am an ordinary gynecologist.
Long live Foxy and long live you, sir.
Yeah. Thank you. I love Foxy. I love you people for that. Thank you. Thank you very much. Thank you very much.